First of all, hello, and thank you very much for being with us today. I'm Louise Williams, and I'm the Archivist at Lothian Health Services Archive, or LHSA. I'm joined by Louise Neilson, Project Archivist on LHSA's Wellcome-funded Speaking Out project, which is making papers from Lothian gay and lesbian Switchboard more accessible through careful cataloguing. LHSA is NHS Lothian's archive, and we're based in the main library, University of Edinburgh, with the largest house archive in the UK. So today we'd like to introduce some of our collections that challenge the established top-down way in which health history is often reflected in archives. We're going to highlight how LHSA's approach to describing collections and representing the communities who generated them is changing. And part of that is acknowledging that the history of health goes way beyond the more traditional hospital record. So before we start, a warning that we'll be making reference to distressing themes in parts of the talk, such as discriminatory language and mental health issues. So I'm just going to move the next slide on. So if you don't already know us, just a very, very quick introduction. So LHSA collections date from 1594 right up to the present day and take a variety of forms, as you can see from the slide. And material comes to us in two ways. So first, we hold records transferred from local NHS hospitals and the boards that manage them. And this includes records from long established hospitals that were taken into the NHS in 1948. Secondly, we look after more general records about healthcare in our area. And these come from a range of people and organisations. So, for example, we could have an individual nurse donating records of her career to archives of voluntary sector organisations working in healthcare. But to frame Louise's talk to come, I'd like to focus on LHSA's records around HIV, or human immunodeficiency virus. Now, we've been collecting on the theme of HIV since the late 1990s, when our then archivist realised that really important evidence was at risk of being lost. Our HIV collections differ from a lot of our more institutional holdings. Even inside collections that we've got about HIV from NHS departments, materials can come from many different sources, such as voluntary and community groups. And also information's on many different formats, as you can see from the images here. And there's also a huge variety of materials that you wouldn't expect to find in an archive, like condoms, balloons, bunting and badges. Now, Edinburgh's history with HIV stands out because health services, local authority providers, prison and police services and voluntary groups and charities work together to fight a high incidence of HIV in the city that was at the time labelled the AIDS capital of Europe by the right-wing press. Now, this joined up working is a lot more common now, but it really stood out in the 1980s and the 1990s. And our collections give a very complete picture of this. The collections gained UNESCO recognition in 2011, and funding from Wellcome for vital cataloguing and preservation work followed the next year. Since then, we've continued to collect around HIV, particularly because records from groups working outside more official frameworks can be especially vulnerable to loss. There may not always be an organisational archive to house them, for example, and sometimes split or changing governance in voluntary organisations means that records can become dispersed or even just untraceable. So to put things in context, to date we hold around 20 paper and mixed media collections around HIV and 18 oral histories. So as an NHS archive, most of our collections are institutional. They reflect the role of hospitals and organised health services and those who worked in them for understandable reasons. Even though records may be about the general public, for example, as patients, sometimes it can be hard to get a point of view outside traditional healthcare institutions and orthodoxies. And even personal papers reflect views of that world. This state of affairs can seem particularly stark the further back in time you go, And I've chosen these pictures of early career medics from the Royal Infirmary of Edinburgh from the 1850s to the just before the 1950s as a rather stark illustration of that point. There's sometimes not much we can do though about viewpoints that were prioritised in the distant past. But as archivists, I think we should be aiming to reflect the range of experiences that come together to make up our collective memories of things, because individuals and institutions don't operate in vacuums. Our HIV collections aren't the only holdings to reflect healthcare outside the institutional sector by any means, but working with them on a day-to-day basis has raised a number of factors about the way holdings can be described and experienced. And being privileged enough to look after them has led to some changes. And I'd like to mention three main aspects of this. Now, first, the relatively recent time period of our HIV collections means that many of those involved in the services that they document are still with us, with quite a few living locally. So in 2015, we began recording oral histories to add flesh to the bones of our paper collections, if you like. We also took in pre-existing recordings. And these histories have added new dimensions to the more official record of events, and often filled in gaps where sometimes the documentary evidence let us down in terms of what happened to certain services and how they operated day to day, for example. And on the slide, you can see Ian Phillips, who we were lucky enough to have with us to start this process all rolling. The histories record experiences of those working in HIV treatment and care in the public and voluntary sectors, and some are from people living with HIV. And remember, the two aren't necessarily mutually exclusive. Second, caring for our HIV collections has really highlighted the use of language around health for me, both in archive materials themselves and in their catalogue descriptions. When more and more people were becoming ill with a mystery condition in 1981, for example, the acronyms HIV and AIDS, or acquired immune deficiency syndrome, just didn't exist. And it wasn't even until 1984 that it was realised that a specific blood-borne virus was responsible for weakening people's immune systems. So since the very beginning of the HIV epidemic, language around it has evolved and shifted as well with the material and cultural landscape. And now the connections between language and stigma are hopefully becoming more widely known. So, for example, this is part of an HIV language guide produced by the Manchester Charities, the George House Trust. And I find it really useful now in talking about how HIV is described today. Because descriptions of some of our HIV collections are now getting a little bit older too, sometimes legacy terms are also reflected in these. So, for example, when we took in more material from Scotland's HIV and hepatitis C charity, Waverley Care, they advised us that our overall description of the collection was using terms that were perhaps a bit outdated, and they worked with us to write that. And for me, this really highlighted how important relationships are with creators of collections and those whose experiences are reflected within them. And as I help users to navigate catalogues to our HIV collections, I've also started to think about representation in description. Now, some items collected by more mainstream health services, like, for example, health board departments, are often the only sources of information that we have about historically important voluntary sector organisations or themes that are not often represented. And I've used this slide to show some examples of this. And these materials are really important to highlight to researchers. And I think if we could do things again with hindsight, and also with a collections management system, which we have now to allow us more flexibility in how we describe things, I'd rethink about how users are signposted to these items. And finally, from me, the experience of building holdings around the history of HIV has fed into our plans and our policy documents. We want to collect a genuinely representative range of voices and perspectives inside both our NHS holdings and our more general holdings about local healthcare. And we also want to build our HIV holdings further on account of the actual and potential vulnerability of many of these archives, both on a local and on a national level. And these commitments are now written into our collections policy and into our collections development plan. So this has been really a bit of introduction in how perhaps my thinking's changed. But what I've been describing is perhaps a more traditional approach towards working towards wider representation in collections, at least in terms of archival practice, even though the archives I've been talking about are very, very far from traditional. And on that note, I'd like to introduce my colleague, Louise Neilson.
Oh, sorry, it's me. Okay, so my name is Louise Neilson. I'm the project archivist with Lothian Health Services Archive. So I'm working on the Wellcome Trust-funded project Speaking Out, which involves cataloguing and promoting the archive of the Lothian Gay and Lesbian Switchboard. So I'm going to start today by giving you a really quick overview of Switchboard and the collection before talking a bit about the aims of the project. So next slide, please. So the Lothian Gay and Lesbian Switchboard was founded in January 1974 after the gay rights organisation, the Scottish Minorities Group, received a request from the Samaritans who wanted to refer their clients to a specifically LGBT organisation. So a helpline was then established. It took its first call on the 2nd of March 1974 and became the first gay switchboard in the UK, beating London by just 2 days. And in the 1980s, it became the first registered gay charity in Scotland. The service took on a few name changes over the years. So it was initially known as the Edinburgh Befrienders, and then in 1984 it became the Edinburgh Gay Switchboard, and it also expanded to operate a dedicated lesbian service known as Lesbian Line in 1984 as well. And then in 1995 it became the Lothian Gay and Lesbian Switchboard, and it operated as such until it closed in 2009. So Switchboard offered a unique listening service and in-person befriending service to anybody who was experiencing issues or difficulties in connection with their sexuality. And they provided practical information such as details about gay-friendly organisations and counselling professionals, and provided sexual health advice. Switchboard activists filled a significant gap in mainstream healthcare provision by offering tailored support to LGBT people, and by publicising sources of support through their specialist knowledge, and through communicating with hard-to-reach groups with public health messages. So Switchboard was not only a helpline. Volunteers worked with organisations to raise awareness of LGBT issues. So for example, in the 1970s, volunteers delivered education sessions on homosexuality to medical students and clinicians in local hospitals, and they also worked with the early HIV information charity, Scottish AIDS Monitor, to communicate key messages on sexual health after cases of HIV and AIDS came to light in the 1980s. Next slide. The collection consists of records created by and collected by Switchboard, and these date from 1973 to 2009 and consist of largely paper-based material with a small number of photographic prints. So records include administrative files such as minutes from the early days of the organisation through to the late 90s, correspondence on campaigns that Switchboard was involved in, such as the campaign to lower the age of consent for gay men. Also contains annual reports, staff files, publicity material, subject-based folders on LGBT health and social issues, personal correspondence written to befrienders from service users, call log books and cards which recorded information about calls received through the Switchboard, statistical call sheets, files relating specifically to Lesbian Line, LGBT publications, reports and zines, and a large collection of press cuttings from local and national press which cover LGBT plus issues from the late 90s through to around 2004. Next slide, please. So while uncatalogued, the complex nature of the collection prevented it from reaching its potential as a research resource. So the aim of this project is to maximise the research use of the collection through careful and detailed cataloguing. The collection is complex because it contains a large volume of personal and sensitive data. So this includes data relating to volunteers who ran the service, as well as data relating to those who contacted and used the service. And of course, these records are closed under data protection legislation. So people who contacted the helpline did so with the understanding that this was a confidential service, and evidence of people's anxieties around confidentiality are evident throughout records such as the call logs. So protecting their identity is extremely important. Where callers' data is concerned, it's not just names that could allow them to be identified. So from our experience of working with confidential data, we know that confidentiality is not just a name, but rather it's pieces of information that could be placed together to work out an identity. So records such as call logs include information such as the caller's location, their occupation, their marital status, which sometimes includes the name of their partner and occasionally also includes the name of their children. And the call logs also and correspondence contain physical descriptions of the callers, which were provided when befrienders were due to meet up with callers in person. So it requires very detailed and very time-consuming scoping to identify closed or open records, as the information can be buried within very text-heavy documents. The collection is also complex due to the challenging and often upsetting nature of some of the topics and themes within it. So call cards and correspondence contain descriptions of trauma experienced by callers, including physical and sexual abuse, domestic violence. They also contain descriptions of mental health issues, including descriptions of attempted suicide. So these descriptions can be extremely detailed and, as you can imagine, are often very upsetting to read. It's something going into this project that myself and the rest of the LHSA team were acutely aware of, and we know that it's important that we identify potentially upsetting material so we can make researchers and archivists aware of where this material exists, so we can minimise the impact of working with distressing records. Next slide. So in order to open up the collection to allow for research use, it's been important to apply different levels of cataloguing in sympathy with the characteristics of different record types. So the project will use item level cataloguing to maximise the visibility of what are important sources on LGBT health, welfare and equality, and these sources would remain hidden in folder level descriptions. So for files that feature both confidential and non-confidential documents, such as folders of minutes, these have been catalogued to item level to increase immediate research use. And with records such as statistical call sheets, which are largely open but do contain some personal data, these have been arranged chronologically with closed items stored separately to reduce the need for physical redactions every time the material is requested. And we do anticipate that these records will be in heavy demand. For clearly confidential records such as correspondence, which includes personal letters from callers, these have been catalogued to file level with closure periods applied by folder. And contents of certain letters are going to be transcribed in a non-identifying way to stimulate research interest. Reasons for restrictions will also be provided within the catalogue at the appropriate level, so we can convey that the closure of certain material is not a matter of erasure or censorship, but that these restrictions are in place because it's necessary to protect the information rights of identifiable individuals. So cataloguing directly into archive space, which is our collections management system, has allowed us to increase the transparency of our decision making. As previously our catalogues were in PDF format and didn't allow us the space to add in more complicated access statements or more complex scope and content. So I'll also be carrying out a full review of over 5,000 call cards to create a record of those exploring particularly sensitive subjects. So when academics apply to NHS Lothian's Caldecott Guardian for permission to use confidential data, which is the only way that this data can be accessed if it falls inside closure periods, then Louise Williams is required to provide evidence of the record's main sensitivities. So by providing a detailed survey of the collection, we'll be able to give an accurate picture of the contents, and that would then enable a responsible decision on access to be made. So a lack of knowledge of the content of records such as the call cards has halted academic access to the complete collection in the past, which has made what is an extremely valuable data set completely inaccessible. And conducting a review like this will also allow us to alert users to potentially difficult subjects. So the importance of archives from previously neglected communities is measured by the content and the context of the records collected. So by extracting these information-rich records from more generalised descriptions through the use of item-level cataloguing is just another step in making neglected archives of mental and physical healthcare, including the communities that created them, more visible. Next slide. It is important to highlight that the collection does contain some outdated and potentially offensive language, particularly in relation to terms used to describe groups such as sex workers, but also in descriptions and terms used to describe the trans community. So for example, there are frequent uses of the abbreviations TV/TS in statistical call sheets, in call cards, and in other material collected by Switchboard. So TV is an abbreviated form of the term transvestite, used to describe individuals who wear clothes associated with a gender other than their gender assigned at birth. And TS is an abbreviated form of the term transsexual, used to describe individuals whose gender is inconsistent with or not culturally associated with their assigned sex. So outdated, contentious and potentially offensive language has been retained and reflected in the description where this language is original to the archiving material being described and where it reflects the historical context of the material. And that includes the biases and prejudices of the material's creator. So this could be in the title or the body of an item or in the original in an original folder title. So outdated or offensive language from archived material may also be retained in descriptions when the inclusion of that language significantly facilitates the discovery of the material. So where I've retained this type of language, I'll be indicating that it is original to the material that has been described through the use of quotation marks, and I'll also be describing including a definition and a preferred term within scope and content, within the scope and content, and through subject tagging. I have been using Homosaurus for definitions and to ensure I'm including preferred terms. If anyone's not aware of Homosaurus, it's an international linked data vocabulary of LGBTQ+ terms. The vocabulary is intended to function as a companion to broad subject term vocabularies, such as the Library of Congress subject headings. The Library of Congress subject headings can be problematic, and it has been argued that its hierarchical system promotes heteronormative ideals and that it limits niche or non-dominant LGBTQ+ topics. Next slide. As well as using cataloguing to open a collection, I'll also be building on LHSA's existing relationship with local LGBTQ+ groups, and some of these groups also include previous Switchboard volunteers. I'll also be working with academics and researchers so we can promote the collection and generate discussions on language and descriptions. I'll be conducting a small number of oral histories with Switchboard volunteers, and I'll be using collection items as a stimulus for discussions to provide additional context and interpretation. So through an outreach event this month, I was able to meet two Switchboard volunteers, and listening to their reactions to the collection and their insights and their stories has provided personal experiences and views that can be gained from the records in the collection alone. So these stories will be captured in oral history interviews. They'll then be catalogued and they'll be transcribed to ensure maximum possible research access. I'll also be hosting a symposium early next year, which will bring together researchers and archive professionals. And this is going to explore the tension between the need for sensitivity when researching and describing history of sexuality archives and the associated danger of censorship and erasure of marginalised life histories. Next slide. As well as the main Wellcome Trust funded project, we were fortunate enough to receive additional funding from ScotPen to conduct outreach events and engage with local LGBT groups in order to produce a digital exhibition. So the exhibition will be based on collection items and it will also include new work created as a response to the collection. So I'll be working with a workshop facilitator to deliver creative writing and zine making workshops with participants from LGBT Health and Wellbeing and LGBT Youth Scotland. So exercises are based upon past and present LGBT experiences, which are reflected in the collection. And so far we've delivered writing workshops exploring safe spaces and protest. The project will use intergenerational community collaboration in order to inform the way in which LGBT archives and historic collections are described and interpreted. And it will work to break down barriers to access to LGBT archives in institutional settings. The project will also demonstrate the power of archives to stimulate discussions on contemporary experiences to produce an accessible and relevant exhibition for all ages. Filming is also going to be used to allow participants to use their own voices to describe the collections and to describe or narrate their own writing and to capture their reactions to the collection. And then these recordings will then be used within the exhibition. So that was just a really rushed run through of everything that's involved in the collection. So yeah, that's everything from me, but I just kind of wanted to stress what a truly amazing collection this is, and it's been a pleasure to work with it. So I'd happily take any questions that anyone might have.
Thank you both very much. That was, yeah, a fantastic insight, and the volume of work that you've got ahead of you, Louise, in all the cataloguing is very impressive. Thank you very much. If anyone does have any questions, if you'd like to type them into the Q&A box or a chat box, or if you raise your hand, I will then be able to sort of switch on your microphones. Just one thing, and I don't know if you'll be able to provide information on this, but I hadn't realised that the Switchboard was so early in its founding, because that's obviously before it is decriminalised in Scotland. Was there then sort of attempts to close it down, or did they just sort of fly under the radar?
There's lots of records within the collection about what to do if the area that they operated out of is raided, or what to do if they're confronted by the police, or if members are arrested. But they were a very vocal organisation, and they worked really hard on the campaign to decriminalise homosexuality. So I'm not aware of any particular attempts to close them down, but they were very aware of any potential difficulties and legal challenges that might come up.
Super, thank you very much. So we've had a few questions in. The first one is about person-centred language, and it's Helen says that there's been a lot of rejection of this within the disabled community. Many disabled activists prefer the term disabled person rather than person with disability. She wonders if there are similar debates around HIV.
I have to admit, firstly, just to be, I think it's a really good question. I'm not completely sure, being absolutely honest. I'm I'm not aware of them, but that doesn't mean that that doesn't exist, and it's something that I'd like to look into more. I think that at the moment there's a lot of I'm not an expert in the field of HIV by any means, but I think from what I've been able to gather through working with the archive is people are very, very aware of the way that language can impose stigma. So, for example, using terms like suffering from, or a label of someone as HIV positive as opposed to living with HIV. I think there are a lot of discussions around that, but I think it's something that I could and should actually definitely follow up by talking to the contacts that we have, for example, in Waverley Care and HIV Scotland. So that's a really good thing for me to follow up. So thank you for that, because I'd like to be able to talk about HIV now and be aware of the current and how debates are evolving. I'm sorry if that wasn't a very full answer to that question. It's something that I think I'll have to go away and think about, which is why I enjoy working with these archives so much, because they bring up so many issues like this.
Thank you. And Louise, Neilson, would you be able to elaborate on how you use subject tags to flag material, sensitive material, or inappropriate language?
Yeah, so the subject tagging is being used to ensure that preferred terms are included and to make sure that I can link across the collection. In terms of flagging potentially upsetting material or ensuring that any problematic language is flagged, I've been doing that at the moment predominantly in the scope and content field, so that I've got the space to kind of elaborate on the use of that language and to flag up to any potential users that it does contain problematic language or potentially upsetting material. I don't know if that fully answers the question.
And just somebody's wanting information on the index card itself. They're not physically redacted, the sort of black boxes, that is just on the digital version?
So the call cards are completely closed at the moment, and then what I will be doing is I'll be creating an index of every single call cards, so we will know exactly where any potential upsetting material is. We'll be able to identify open call cards through that process, but it's quite difficult to find any call cards that don't potentially identify the individual that was calling. So it will be through our process to allow access to closed materials that access will be decided upon. So that's kind of Louise Williams' field, where she will put through an application to the NHS's Caldecott Guardian, who'd then make a decision on whether or not the call cards can be accessed. I'll also be using transcription to open up as many as possible in a non-identifying way, but they are they're obviously extremely valuable and extremely interesting records, but they are very complex, and it's not an easy task at all to open them up. I don't know if Louise is trying to jump in here or not.
No, I wasn't. No, but I think I totally agree with you about the sensitivities of them, because I think, Louise, as well, it's only when you've been sort of really looking at these that you realise that this collection is perhaps not like other collections around Switchboard, because different switchboards recorded their calls in different ways, and Switchboards had different relationships with the communities whom they served. So levels of identification and documentation across different collections like this are going to be different. So what is true, for example, for one collection might not be true for another, and it happens that ours is, what we have in this collection is extremely sensitive information that could potentially reveal people's identities, and that we do have to we do have to treat very carefully. But I think what Louise's transcription will do is to give researchers an idea of what is in these call cards, so that then they can decide whether they do want to apply to see those collections through their academic research. But we do have a very, very rigorous process for that. It sounds prohibitive, but it's there for a reason, and it's there to protect the identities of those individuals in the call cards, who, remember, never expected their material to end up in an archive. And that's something we come across with things like case notes as well. So respecting people's privacy is, as well as for both ethical reasons and compliance with legislation reasons, is
yeah, and that concern over confidentiality that I mentioned in my talk, it's really, really evident throughout the call cards. People are frequently concerned that they are going to be identified, and as Robert was saying, these call cards, some of them date back to a time where we hadn't had decriminalisation yet, so people were really, really worried that they were going to be identified. And yeah, it is really, really important that we manage to protect their identity.
Thank you both very much. And just finally, somebody has asked about the zine making and creative writing workshops and what you have planned.
So at the moment, the workshops that I'm delivering are specifically with members of LGBT health and wellbeing and LGBT Youth Scotland. So that's working with people as young as 13 to people in about their 60s and 70s. So they've been organised with our project partners within those two organisations. So at the moment that's all that's scheduled, but I will be keen to open up to some public workshops in the near future. It's something that we've in my normal role as access officer in LHSA is something I've done quite a lot. So I'd be keen to open up to some public workshops, and I can, if you follow us on Twitter or Facebook, we can keep you updated on anything that's to come.
Super, thank you. Thank you all very much, and I'm sure you will all join me in giving a big round of applause and huge thanks to both Louises. That really was a fantastic insight and very, very interesting. Thank you very much. We will have another session on the 22nd of November with Professor Jackie Eccles from Dundee, who will be speaking about the language of asylum and mental health records. She's done a lot of work with practitioners, mental health workers who have actually then gone into collections to see it. So it should also be an equally interesting session. So thank you all very much and enjoy the rest of your days.